Today's Senate hearing was anything but routine. If you thought these sessions were all about paperwork and posturing, think again. Things got heated, and fast, as senators and medical experts took off the gloves over the future of abortion pills in America. Let's set the scene. Senator Bill Cassidy kicks things off, zeroing in on the abortion pill mifepristone. Now the FDA approves this medication only up to 10 weeks of pregnancy. Cassidy isn't letting that slide. He straight up asks medical witnesses, would any responsible doctor prescribe mifepristone at 20 weeks? That's double the approved time frame. Tensions in the air. Dr. Verma, a key medical expert today, doesn't flinch. She says no. She would not prescribe the drug that far along, and stresses that abortion care should always stick to the evidence and the guidelines. Cassidy keeps pushing, pressing for a yes or no. The room starts to feel like a courtroom. Now here's where it gets spicy. Senator Bernie Sanders jumps in, demanding Cassidy let Dr. Verma finish her answer. The ideological lines are drawn. On one side, strict medical limits. On the other, the realities of patient care. This moment, it's already lighting up the headlines.
Dr. Verma, you mentioned not restricting access to safe, evidence-based care. Would you prescribe these drugs for someone at week 20 of her pregnancy?
Thank you for that question. What we are seeing with some of the cases that have been highlighted...
Would you prescribe, it's only FDA approved up to week 10. Would you prescribe these drugs for someone who is at week 20 of her pregnancy?
I would not prescribe them in the way you're describing.
Now,
What we're talking about here, though...
Let her answer the question, please.
No, she answered the question. It's not here to go beyond answering the question, Bernie.
It doesn't stop there. The hearing takes a darker turn. Testimony reveals that you can get abortion pills online by just filling out a form. No telehealth, no medical history, no human connection. Officials even pulled off a controlled purchase to prove it. Pills delivered, no questions asked. Dr. Rubenhorst calls this irresponsible and says it's way below the standard of care we expect for any serious medication. Hearing stuff like this, you start to realize what's at stake. If you want more honest, unfiltered breakdowns of moments like this, the kind mainstream coverage skips, go ahead and hit subscribe. Then, the hearing gets personal. Witnesses talk about coercion, real stories where women, sometimes even teens, are forced into taking abortion pills. One district attorney shares a case where a 16-year-old girl was allegedly pressured by her own mother. The consequences: medical complications, criminal charges, and trauma that could have been prevented with a simple in-person visit. Doctors stress that private interviews are often the only time victims reveal abuse or coercion. Without that face-to-face, these warning signs, they're missed, and the system fails those who need help most.
Next. Attorney General Muro, you spoke of, in your testimony, 2 women who were prescribed this medicine taking it after week 20. Did I hear that correctly? Your microphone, please.
The gestational age, as determined by the doctors at the emergency room that treated these women, said that the babies were approximately 20 weeks.
Now,
so yes.
Dr. Verma suggested that telehealth is an appropriate way to prescribe this. But again, if I listened to your testimony carefully, and I did, you don't have to have a telehealth visit. I think you spoke of just filling out a form online with no history taken. Did I hear that correctly?
That's correct. It's a form that you fill out online. There is no human contact at all. No human contact. No human contact, and the paperwork that comes with the pills, and we know this because we conducted a controlled buy of these pills through this process. The paperwork that you receive, we also know this through one of the cases, Rosalie Markovich's case.
We know this.
We know
There's actually some common ground here. Dr. Verma has suggested that it should be evidence-based and that some sort of human contact is implied. And what I'm hearing from you is that it's being prescribed according to the physician who actually examined the patient post-loss of the child, is that they were gestational week 20 and there had been no contact necessarily.
That's correct. There's no human contact in this process.
Dr. Rubenhorst, is that like standard of care? No human contact to prescribe a medication like this?
I would say it's not only standard of care, but it's irresponsible. For example, if I had pregnant woman who came in with a bladder infection, and I just talked to her on the phone and prescribed an antibiotic, that would be malpractice.
Okay. Now, Dr. Wubenhorst, Attorney General Murrell, very disturbing, spoke about women being coerced to take these pills. You mentioned it too. Can you comment further on that?
Yes, there's substantial evidence in the medical literature that many abortions are coerced. In addition to that, there are published, I would say published 19 cases where, as I mentioned in my testimony, boyfriends, abusers forced women to have an abortion. And so that's just the tip of the iceberg.
And Attorney General Murrell, Tony Clayton, the district attorney, I think, in Point Capee Parish. Can you describe the case? I think it was the mother that forced the young lady to take the pill, and there was a complication. Can you describe?
Her mother, she was 16 years old, and her mother, who had a documented history of severe physical abuse of that same child, coerced her into taking the pills because she did not want the burden of an added baby. The little girl, the young woman, had been planning a gender reveal party, and instead of having a gender reveal party, she was undergoing an abortion after her mother saw her take the pills and then abandoned her to abort the baby alone. She panicked and called 911. She did testify, and the mother was indicted, and the clinic was indicted, and the doctor has been indicted, and Governor Kathy Hochul has blocked our extradition of the doctor to hold the doctor accountable for giving the pills to the mother who coerced her daughter to have an unwanted abortion.
Dr. Wubenhorst, you and Dr. Verma spoke about the in-person interview as the opportunity to make sure that someone understood the implications of taking these pills and to make sure they're not being abused. If that young lady had had an in-person interview, would you have been able to see that it was her mother dictating her course of action and she was being coerced?
Yes, one of the things that we try to do when we have these inpatient interviews is to sit down with the woman alone, apart from her mother or her boyfriend, whoever may be trying to abuse her, and to ask these questions. And when I have done this, when women are in an abusive relationship or trafficking, they will say, "You're the first person who's ever asked me about this," and they will disclose.
Okay.
Today wasn't just about policy, it was about people, real lives, serious consequences. Cassidy and Sanders showed just how split lawmakers are. But the bigger question? Are current practices protecting patients or putting them at risk? What happens next could completely change how abortion pills are regulated across the country. And trust me, this debate is just getting started.